Hello, thank you for joining me today. My name is Carla. I am the Director of Education and Partnerships at NeedyMeds. And today I will teach you how to find healthcare cost savings resources on the NeedyMeds website. Before we get started, I wanted to go over a few things. You can feel free to ask questions at any time by typing them into the questions section of your GoToWebinar control panel. Just know I will reserve answering questions until the end. If I don't get a chance to answer your particular question, I will follow up with you personally via email. Also, I will provide my contact information at the end should you have any other questions. This webinar is being recorded and will be available for viewing on our YouTube channel, which I will direct you to during our presentation. A copy of the PowerPoint presentation can be found in the handout section of your GoToWebinar control panel. So let's get started with what is NeedyMeds. NeedyMeds is a national nonprofit founded just over 2 decades ago by a retired family physician, Dr. Rich Sagal, and Rich is still our president. On your screen is our official wording of our mission statement, how we achieve our mission, and our vision statement. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through our website, needymeds.org, and our helpline, 1-800-503-6897. And one of the most popular and effective ways we help people to save on their medications is with our listing of prescription assistance programs. Prescription assistance programs are usually supported by pharmaceutical companies and most of the time offer free and some of the time offer deeply discounted prescription drugs, usually name brand, to those that qualify. Of course, not every drug will have a prescription assistance program. When a program is available, eligibility requirements and applications will vary from program to program. One common requirement is that the patient's healthcare professional usually needs to be involved by providing the prescription, signing the application, and submitting the documentation. So, how do we find prescription assistance programs and other healthcare cost savings resources on the NeedyMeds website? So bear with me while I transition out of the PowerPoint onto our live site. As you can see, there is a ton of information on our website, so I encourage you, when time allows, to come back and peruse it further. Today, we're going to spend most of today's webinar checking out the cost savings resources under the Patient Savings tab right here. But I just want to point out a few resources that you might want to look into, again, when time allows. On the top right-hand corner of our site, with the rest of the social media icons, is the link to our YouTube channel. It's the third icon from the left that I mentioned at the beginning of this presentation. Please subscribe to stay up to date on all of our latest videos and webinars. Also, you may not know that NeedyMeds hosts Be MedWise, and you can find that on the bottom left-hand side. Be MedWise is full of accurate, up-to-date patient information and education, specifically a great source for medication safety. This box, the Be MedWise box, like the rest of the boxes on the left and right-hand sides, are on every page, so they remain easy to find. One other thing I want to point out, in the beginning of the year, we updated our monthly e-newsletter featuring health-related articles and valuable resources for advocates and patients. It has been renamed Vitals. You can find that newsletter under the Advocates section. We hope you add your name to the list of more than 12,000 people already receiving this monthly newsletter. Okay, so let's return to prescription assistance programs. Now, you can always begin searching for a cost savings program for a medication by typing the name of the drug into that drug search box on the top left-hand side. But if you are looking specifically for prescription assistance programs, let your mouse hover over that Patient Savings tab. As you can see, a whole bunch of categories pop up. These are all the ways to save on your healthcare expenses. The top left-hand section is dedicated to prescription assistance programs. And as you can see, there are a number of ways to search. You can search by the least common company name or program name, or you can search by the most common way, which is by the name of the brand name drug. So let's say you are looking for help affording the name brand drug Eliquis. You would click on the brand name drugs hyperlink. And then the first thing that happens is a bunch of icons pop up. What these icons do is they show you what type of information is available for that drug. Is there a cost savings program, such as a prescription assistance program or a coupon? Is there more information available about that drug through support pages, for example, or drug videos? Also, you will notice that there is a convenient A to Z index. Many of our large categories have this for easy searches. So returning to our search for Eliquis, I'll choose the letter E in the A to Z index and then scroll down until I see Eliquis. When you find the medication you are looking for, go ahead and click on the hyperlink. And there are those icons again. That lets you know that there's more information available about Eliquis. There's drug videos, there's support pages, and there are also cost savings programs. This icon indicates that there is at least one coupon available, and the icon on the far left indicates that there is at least one prescription assistance program available. I'm going to make the screen really small. Don't worry about seeing the text. I just want you to get a quick snapshot of what the prescription assistance program page looks like. And they all look the same. So now I'm going to make that a bit larger so we can talk about what's on your screen. Currently, there is only one program available for Eliquis. If there was more than one, the programs would be listed with the ones that offer the least assistance at the bottom and the most assistance at the top. Always be sure to scroll to the bottom to make sure you're not missing any programs. Okay, so right at the top, you will always find the name of the program and the contact information. Now, that's important because you're going to want to be sure to direct all questions about the program to the supporting company or program provided here, as opposed to NeedyMeds. Underneath that, you'll find the application section, where you can usually find a hyperlink to the application itself. Under that is the medication section, where you will find the medications covered by this program. And each program also has an eligibility requirements section. Although I stated in the beginning that eligibility will vary from program to program, it is almost always based on three factors: insurance coverage, income, and residency. So let's talk about those three things. First of all, insurance status. Now, like this case, oftentimes prescription assistance programs are for people that have no prescription coverage. But I want to stress that that's not always the case. There are prescription assistance programs where even if you have insurance or drug coverage, you will still be eligible. So always be sure to check. Let's talk about income requirements. Now, income requirements are always part of the eligibility requirements, and they're often based on a certain multiple of the federal poverty level. And because that's so common, we put a convenient federal poverty level income calculator right here. Let me show you how easy it is to use. Let's say we have an individual that makes $47,500 a year. You can see I use this example often. You'll notice I only typed in the numbers. Don't type in the periods, commas, or dollar signs. Let's say this individual is supporting a family of 3, and that income that I typed in there is the same income you would put in your tax information at the end of the year. That's all the information that's needed. And the results indicate that this individual's yearly income is 222% of the federal poverty guidelines. Now, when we click back to the eligibility requirements section, you can see that this individual clearly qualifies, which is great. But what happens if the calculation showed that this individual was not eligible? Maybe he found himself just above the eligibility requirements at 305%, for example. Well, when that happens, don't despair. If your income is slightly over the income, we recommend applying anyway. If that point you are denied, you could always ask the program to make what's called an economic hardship exception. And it's always worth calling anyway, because if you're not eligible, they may even be able to direct you to another cost savings program. At that point, if they don't have another cost savings program that they can direct you to, or if you are denied, you can still officially appeal. Okay, so let's talk about residency requirements. Don't assume that if you are working with a population that is undocumented, that they will automatically not be eligible. Be sure to check out the residency requirements, where we will provide the detailed information for each program. Also, be mindful of this application section. This will let you know the important details, such as if or how the doctor needs to be involved, as well as how long the decision will take. And that's important because you never want to put yourself, a loved one, a patient, or a client in a position of missing their medications. Scrolling down, that medication section is also important because it lets you know details such as where the medications will be mailed to and the details for reapplying. Always be sure to check out the additional information section, because that is where we will put other pertinent information that does not fall neatly into the other categories. And I do want to stress that we encourage you to call the program with any questions you may have, or even simply to advocate for yourself. Now, applications for prescription assistance programs can be complicated. So returning to that patient savings tab, you'll notice there's a link for help with prescription assistance applications. We've put together a directory that lists nonprofits that will help people apply to these programs. And the places we have listed are usually free or will offer assistance for a very small fee. And you can search, as you can see, for help in your area by zip code or by state, and then the programs will be listed alphabetically by city. Now, returning to that patient savings tab on the top left-hand side, I'd like to point out our $4 generic discount drug program. This is a directory of all the discount programs for generic medications available at major retailers. Now, although it's called the $4 generic discount drug program, most will range in price from between $4 and up to $15 for a 30, 60, or 90-day supply. As you scroll down, you'll see there's a number of ways you can search. You can search for the particular medication. You can search by participating store or pharmacy. But for the purposes of this webinar, and just to do an easy demonstration, I'm going to do a broad state search. So let's see what's available in Alabama, since it's the first state that pops up. And the results yield that there are currently 11 discount drug programs in the state of Alabama. And hopefully you'll agree that all the pertinent information is now on your screen. The left-hand column lets you know the name of the store participating and a hyperlink. The middle lets you know the name of the program. And most importantly, the far right column lets you know exactly what this program will help you, your patient, or your loved one save. A lot of times, again, it will range between a $4 and up to $15 discount. Sometimes it's a bit pricier, and sometimes the estimated savings will be shown according to percentage as opposed to dollars. So let's move on to other helpful sections of the NeedyMeds website. Again, returning to that patient savings tab, if we scroll down, you'll see one of our most popular destinations on our website, our free, low-cost, and sliding scale clinic section. I'm happy to let you know that our clinics used to be just in two categories, medical and dental, but now it's broken up into four categories: medical clinics, dental clinics, mental health clinics, as well as substance addiction clinics. They're all set up the same way. So again, for the purposes of this webinar, I'm just going to click on that first medical clinics hyperlink. And as you can see, it is a pretty robust database. There are almost 17,000 free, low-cost, or sliding scale medical clinics in this database. And you can search a number of ways geographically. You can search really narrowly by your street address, by the zip code, or by the state. But since it's just such a large database, let's do a zip code search. When I click search, the results yield that there are 8 clinics in the 94974 zip code. And then as you scroll down, you will see that all of the pertinent information again is on your screen. And we hope you agree with that. We rely on our users to be vocal about their experience on the NeedyMeds website, so do let us know what you think. On the left-hand column, you'll see the clinic all the details you need to know about the clinic. The name of the clinic, the contact information, and the website. Next, you will find the eligibility column. That'll let you know who can be treated at the clinic and details such as what fee the patient can expect to incur and whether or not the staff speaks in other languages. The far right column, labeled details, lets you know things such as the services that this clinic provides, and oftentimes the hours of operations. Now, although we do pride ourselves on our information being accurate and up to date, we always recommend that you visit the website or give the clinic a call before you're visiting to find out details that may be important for you, such as whether or not you will incur a fee, are there staff members that speak another language. Another really helpful tool is if you are interested, for example, in sharing this list of all 8 clinics, you can print it out by choosing the print all option. Or if you want to narrow it down further, you can click on only the clinics you're interested in and then choose the print instead of the print all option. And this will generate and print a list only including the ones you choose. And that's a great tool for healthcare professionals in particular if you want to provide your clients with a list of clinics for them to choose from. Another important destination on our website under that patient savings tab is coupons and rebates. This is where you can find coupons, rebates, savings cards, free samples, trial offers for prescriptions and over-the-counter medications and supplies. Just like our other databases, there are a number of ways you can search. You can search by the name of the drug, by the name of the product, but in this case, you can also search by category, which means medical category. And when I click on that, a long list of alphabetized medical categories pop up. I'm going to go ahead and click on asthma just so you can see what the results yield. What is also helpful is there are those icons again. So this database will also let you know if there is additional assistance available, such as whether or not that medication has a prescription assistance program or is part of the $4 generic drug discount program, and whether there is more information about that drug or product. Again, and you can find that out if that support pages icon is available or the drug videos. And then the products and the drugs are listed alphabetically. We actually updated this part of our database last year. It used to just be a paragraph, but to make it easier to read based on feedback we got from our users, we broke it down into more easy-to-read bullet points. We also added a link to the manufacturer's offer, and we put a convenient way to have the NeedyMeds drug discount card texted, emailed, or printed out. And of course, later on in the presentation, I'll talk to you about why the NeedyMeds drug discount card can also help you to save on your medications. Now, aside from the prescription assistance programs, the second greatest source of savings is through our diagnosis-based assistance programs, and that's in the center section, again, under that patient savings tab. Diagnosis-based assistance programs provide financial assistance for costs associated with a particular diagnosis. Now, this database is different because for the most part, it does not focus on medications. For the most part, it excludes medications. What it does include instead are other necessary medical expenses. For example, maybe you need durable medical equipment or supplies or testing equipment, or maybe you need assistance affording something like a wig or house cleaning services or assistive technology. You can search a number of ways. You can search broadly by the diagnosis. You can search geographically by your state or nationwide. You can search by the probably least common program name, and you can also search really narrowly by the diagnosis, the state, and the services offered. But just to demonstrate what this category looks like, I'm going to go ahead and click on that by diagnosis hyperlink. Like the prescription assistance programs category, this is a pretty large section of our website, so you'll find that easy A to Z index. I'm going to go ahead and click on D for diabetes. I like to use the example of diabetes since not only is it a common diagnosis in our country, but it's a great example of a diagnosis that requires a lot of expense in addition to medication. Now, because diabetes is a broad category, it's broken down into some subcategories, but I'm going to go ahead and click on that general hyperlink for diabetes. And the results yield that there are 69 diagnosis-based assistance programs for diabetes. And like the other databases, on your screen is a snapshot of what these programs provide. The left-hand column will provide the program name and a hyperlink. Next, you will find the summary about what that program offers. And most importantly are the far to right columns, services provided and the areas of service. Now, the services provided let you know exactly what this program will help you to afford. Will it help you afford medical supplies, durable medical equipment? Do you, your loved one, a patient, or a client living with a particular diagnosis need respite care? Do you need access to getting a service animal? Now, the areas of service column is also important because this lets you know where you need to reside in our country to be eligible. You'll notice that all of the ones on your screen now say national. That's because all of the national programs are listed first, because regardless of where you live in your country, you are eligible to apply for a national program. And then as I scroll down, you'll see that the state programs are listed alphabetically. So diabetes is an example of a diagnosis that may require people to self-inject. Yet there are limited options for proper disposal of needles and sharps, which leads to dangerous situations for the public and workers, causing exposure to a variety of potentially serious diseases. Because of that, I'm proud to let you know on the left-hand side, you'll see a hyperlink for our Safe Needle Disposal website. We hope that you use this site and spread the word about it so we can work together to educate people on how to responsibly dispose of needles and sharps. After all, safe needle disposal is a public health and safety issue that really is commonly overlooked. So, okay, let's return back to our website. And since we're on the topic of finding diagnosis-based assistance, I want to point out our diagnosis information pages. And as you can see, that's in the center section as well. These are informational or educational pages dedicated to specific diagnoses. Our goal is to partner with other reputable nonprofits to provide the most comprehensive information about a particular diagnosis. The diagnoses here are listed alphabetically. I don't want to spend too much time here. I just wanted to make sure you knew about this destination, especially if you, a loved one, or a patient is newly diagnosed. Under that Patient Savings tab, we also have databases dedicated to medical transportation, which is exactly what it sounds like. Oftentimes, getting to and from a doctor or specialized facility can be a real obstacle or burden. So we've put together a directory that will help people with that transportation. We also have databases dedicated to retreats, camps, recreational programs, and educational scholarships. One quick thing I do want to say about the retreats and camps section. I know oftentimes people may hear the word camps and think that it's for children during the summer, but this is specifically purposefully named retreats, camps, and recreational programs because it offers all types of programs available to people at all ages all across our country at all times of the year. So it's worth checking out. Now, for those of you that are or work with people who are seniors, the government programs database is a great section. Now, of course, we do have all of our state-sponsored programs available, but it also has pretty exhaustive information on Medicare, so it's worth checking out. Now, if you'll bear with me, I'm going to go ahead and switch from the live website back to our PowerPoint so we can talk about another important way to save on your medications, which is with the NeedyMeds drug discount card. Before I move on to talking about that, I just want to put up a slide that lists what we just covered. Okay, so let's talk about the NeedyMeds drug discount card. Now, I'm sure you've heard of other drug discount cards available out there. Drug discount cards are cards that you take together with your prescription to the pharmacy, present it to the pharmacist, and hopefully get a discount. And as I said, there are a lot of drug discount cards available out there. So why is the NeedyMeds drug discount card different? Well, first of all, the NeedyMeds drug discount card is not only free, but it's anonymous, which means we do not track any biographical data about our users. The NeedyMeds drug discount card requires no registration, no enrollment, there's no residency requirements, and it does not have to be activated. You can use your NeedyMeds drug discount card to save on your prescription medications, as well as over-the-counter medications and supplies as long as they're written as a prescription. You can even use the drug discount card to save on your pet prescriptions if they're picked up at the regular pharmacy. If you're interested in learning more about that, shoot me a message in that questions section of your GoToWebinar control panel. Most importantly, in that video that I will provide that will teach you how to use the drug discount card to save on your pet meds, you will see a picture of my puppy Benjamin. So that might just be worth it. You can also use the drug discount card in addition to over-the-counter medications and supplies and pet prescriptions. I also want you to know that the NeedyMeds drug discount card can help you save up to 80% off the cash price. And the good news is that the drug discount card offers a discount 85% of the time it is presented to the pharmacist. And that discount is usually half off the cash price, which is really helpful. Okay. So, a few other facts about the NeedyMeds drug discount card before I move on. Keep in mind that not every product is discounted, and our drug discount card only works at brick and mortar pharmacies for prescriptions. One other thing I am so excited to share with you is that this webinar is just in time to share our exciting update with the drug discount card. Now you can use a drug discount card to save 40% off the list price of durable medical equipment. And this includes products such as diabetic supplies like needles, test strips, or meters, splints and braces, for example, for your ankles, your knee, your neck, your back. It also provides discounts for catheters and incontinence supplies, bath safety supplies like commodes and grab bars, mobility devices such as canes, crutches, walkers, and wheelchairs, and footwear like inserts, and so much more. You simply go to DME, which stands for Durable Medical Equipment, dme.myvirtualdoctor.com. And then you can click Shop to browse the selection of durable medical equipment, or you can search by the product category. And at checkout, you simply enter the ID on your NeedyMeds drug discount card and click Apply. It's as easy as that. And the question we always get is, who can use the NeedyMeds drug discount card? And how can I get a supply of drug discount cards for myself? So bear with me for a moment while I transition out of the live website out of the PowerPoint back to the live website so I can show you exactly how to do that. A few other things I do want to mention about the NeedyMeds drug discount card. Again, we get the question all the time that who can use the NeedyMeds drug discount card? And the answer is anyone. The NeedyMeds discount card fills a gap where someone might not be eligible, for example, for other programs and can't afford their medication. The only rule is it can't be combined with insurance. So if you don't have insurance or drug coverage, you can use the card anytime. If you do have insurance, you may choose to use the card instead. And you may do that instead, for example, if you find that your medication isn't covered, your copayment or deductible is too high, or you find yourself in a coverage gap, for example. Now, if you want to request a drug discount card, right on our website, there's a bunch of places there's a bunch of hyperlinks that will take you to our drug discount card page. Under that patient savings tab, there's a link on the top left-hand side, on the bottom right-hand side, and on our website, on the left-hand side, you'll see a box with that red arrow that says Get Your NeedyMeds Drug Discount Card. If you click on that, you can print out a downloadable PDF. You can fill in the form below. Be sure to check a design you prefer. Probably the least convenient way is by sending us a self-addressed stamp envelope to our P.O. box, but that is still an option. And you can always reach out to our call center experts at 1-800-503-6897, and they'll be happy to drop a drug discount card or a few in the mail. So now let's say you have your drug discount card. To find out what pharmacies in your area accept the drug discount card, and the chances are there will be many because the NeedyMeds drug discount card is accepted at more than 16,000 pharmacies, you return to that NeedyMeds drug discount card page and you scroll down to the pharmacy search. And all you need to do is type in a zip code, for example, of where you're going to pick up that medication. And the pharmacy search will provide you with pharmacies in your area that do accept the NeedyMeds drug discount card. Okay, so now you have your drug discount card. You know what pharmacies in your area accept it. The final step is finding how much that medication is going to cost using that drug discount card. To find that out, you click on the drug pricing calculator on the left-hand side. To find out how much your medication would cost, you will need 4 pieces of information: the name of the medication, the day's supply, the dosage, and the zip code where you would plan on picking up that medication. So hopefully that will be all the information you'll need. You'll have your drug discount card, you'll know what pharmacies participate, and you'll know how much it's going to cost when you pick it up at your pharmacy. One quick disclaimer I do want to say about the drug pricing tool: although it does offer a close estimate, it is only an estimate and it will not be accurate down to the penny. And drug prices change all the time. So don't find out what the drug costs today and go and pick it up a month later. You're going to want to check what the cost is when you're planning on picking it up. I also want to stress, if you or a patient or a loved one does not have access to the internet or a computer, our expert call center counselors can do all this work for you. And again, that number is 1-800-503-6897. I do see some questions coming in, which is great, and I want to remind everybody that you can go ahead and submit any questions that you may have into that questions section of your GoToWebinar control panel. And as those questions are coming in, as promised, I want to leave up the contact information. I put up the email for my colleague Alana. If you are interested in ordering a bulk supply of drug discount cards or educational brochures, you can send Alana an email. If you have any questions regarding this webinar, you can shoot me an email. And once again, there's our toll-free helpline, 1-800-503-6897. So I'm just looking at the questions, which is fantastic. I'm seeing a lot of requests for receiving, as I mentioned earlier, you can use the drug discount card to save on your pet medications, and I'm so happy to see a lot of people are interested in learning about that. I did make reference to this, but we put together a less than 10-minute video on how to use the NeedyMeds drug discount card to save on your pet meds. Again, featuring my dog Benjamin. And I can email that to you, or you can find that video on the NeedyMeds YouTube channel that I pointed out at the beginning of the presentation on the top right-hand side with the rest of those social media icons on our website. And when you click on that, you can type the word pets into the search bar. Okay, another question coming in that we get often is, how does NeedyMeds support itself? So yes, NeedyMeds is a nonprofit, and like other nonprofits, we do rely on corporate and individual donations. We rely on grants and a few other sources of financial support we rely on. We do license fees for organizations' use of our databases. We sell a software called PAP Tracker that helps clinics simplify applying to and tracking prescription assistance program applications for the population they serve. We do receive a small transaction fee every time the NeedyMeds drug discount card is used, and we do have some thoroughly reviewed supporting partners on our website. Another question coming in is, can people with Medicare Part D apply to prescription assistance programs? So that's a great question. And unfortunately, I hate to give this answer, which is it depends on the program. Some will let you apply, others will determine that on a case-by-case basis. You will see the answer to that in the eligibility section of the prescription assistance program listing on our website. And as I stressed before, do not hesitate to call the program. Another question coming in is, when is the NeedyMeds call center open? We are open from 9 to 5 Monday through Friday, but keep in mind we are located in Massachusetts, which is East Coast time. We have a question about whether or not NeedyMeds offers software to track patients' medication applications to see when they expire. Unfortunately, we do not. The only software that we provide, which is for clinics or organizations, again, is called PAP Tracker. And that eliminates the administrative burden of manually applying for and tracking prescription assistance programs. If you're interested in receiving a free demo or more information, shoot me a webinar. Another great question is, I know that we can use this for patients, but can we use these resources for ourselves, our friends, and family members as well? Absolutely. NeedyMeds is a nonprofit organization that provides our website and our call center and our drug discount card, again, not only free, but anonymously. I had the opportunity to mention earlier that our drug discount card is anonymous, which means we do not track our users' biographical data, but that's true for our help center, our 1-800 number, as well as our website. When you call our 1-800 number, you do not have to offer any biographical information. And hopefully, as you saw when I was on our website, you don't have to log into our website. So everything is free and anonymous, and we hope that everybody in our country uses it. Today's presentation will be converted into a video and added to our YouTube channel. And again, you can find a link for that on the top right-hand side of our database. So I'm so pleased that you're interested in using today's presentation as a resource. And for those of you, again, interested in PAP Tracker, I'll go ahead and send you a link. So here's another great question. Can Medicare Part D beneficiaries use the NeedyMeds drug discount card? And the answer is yes. So here's the thing. Anybody can use the drug discount card. The only rule is it can't be combined with any insurance. But here's the thing. If you or a patient or a loved one is in that Medicare Part D donut hole, You can absolutely use the drug discount card to save on your medications, but understand that the money that you use with the drug discount card will not help you get out of that donut hole. So I would say if somebody is trying to get out of the donut hole and it's the beginning of the year, don't use the drug discount card because you're trying to climb out of that donut hole. But if it's the end of the year, it's November or December, and the individual is not going to get out of that donut hole, you might as well use the drug discount card to save on your medications. We also have an audience member asking for downloading the slides that accompany today's presentation, and you should all be able to find a PDF version of today's PowerPoint slide deck in that handout section of your GoToWebinar control panel. If you have difficulty downloading it or can't find it, shoot me a message in that question section of your GoToWebinar control panel. And with that, I want to thank you again for participating in the NeedyMeds Overview webinar, and we do hope that you keep in touch. Thanks again for your time, and have a great rest of the day.